Well, good morning, Queensland. I can report that we've had 15,122 new cases reported in the last 24 hours. 4,575 of those were self-registered rapid antigen tests, and thank you to Queenslanders for continuing to register their positive results from their tests at home. I do have to report we have changed our active cases reporting. We have done a data cleansing, because previously with active cases it was very easy to track in Queensland because they're all in hospitals. But now we've got a lot of active cases in the community. We've gone through and applied the definition that all of the states and territories are using, which is the 7-day rule around what is an active case, which means that we have 86,953 active cases in Queensland. Of course, we know that's just those people who have come forward and got tested, and we are very confident that there's many other people out in the community who we haven't had tested at this stage but are seeing symptoms. Sadly, I report 7 deaths overnight, and again, our condolences to the family and friends of those 7 individuals. I'll let the Chief Health Officer go through the details of those individuals, but I will say this: none of those people had had their booster shot. They were all elderly people, and if I can encourage Queenslanders out there to do anything today, that is get yourself a booster shot. If someone you know who is eligible for a booster shot hasn't got it yet, please encourage them to come forward, and either a public vaccination centre or a pharmacy or a GP. We know the difference that a booster makes, and in fact the Chief Health Officer will talk about some of those statistics today. It is so important people get their booster shot, but also we know there's people due for their second dose, and also people who have not got vaccinated yet. We want them to come forward. We did 30,963 tests in the last 24 hours, and we've had 702 patients in hospitals currently, 47 in ICU, and 15 of those 47 are ventilated currently. So quite a jump, over 50 additional people in our hospitals, in our public hospitals, in the last 24 hours. But thankfully we don't see the corresponding increase in ICU. But we want the least amount of people needing to be hospitalised, and that comes down to getting your vaccination and your booster shot. We are now at 91.59% first doses in Queensland and 88.71% second dose, which is fantastic. Boosters, we've done 954,998 boosters in Queensland now, and the 5 to 11-year-olds, 12.82% are already vaccinated. This is extraordinary. It is 1 week to the day since we started the vaccination for 5 to 11-year-olds, and it is almost 13% of all of those children are already vaccinated. Thank you to the mums and dads and carers, grandparents out there who have brought the little ones forward to get vaccinated. It's been wonderful to go around to many of these vaccination clinics and meet some of these young kids and their parents, and I just am so grateful for them coming forward and getting vaccinated. And of course, we have Minister Grace here today to talk a little bit more about education and COVID and going forward. So the only other message here is one more LGA. Pumperau has shown their first positive case, which means there's one local government authority in Queensland that has not reported a positive case since the wave started on the 13th of December, and that's Booyah. But this now means it's everywhere in Queensland. And so do not assume that you can escape this virus. Get vaccinated. Make sure you're following the rules, wearing your mask, social distance, good hygiene, and of course, if you have any symptoms, testing, either a PCR or a home test, and staying home if you have any symptoms whatsoever. And thank everyone who are isolating and quarantine and doing the right thing, because that helps reduce the spread to your workplace, to your friends, and to your family and loved ones as well. The last thing I do want to say is 000 are still recording people ringing up simply to ask where they can go get a RAT or a PCR test and where the fever clinics are. This is not a reason to ring 000. So please make sure you are freeing up those lines for people who have emergencies and life-threatening conditions. Do not ring 000. You can ring 13 Health or 134 COVID if you want that information. All that information is also available on our social media and our website. So please do not take up 000 resources to simply ring up to where to get a test. Thank you.
Thank you very much, Minister. So we have 7 deaths to report today, 2 people in their 80s and 5 in their 90s. 2 of these people had not been vaccinated, 5 were double vaxxed and none had received a booster. Our thoughts are with their families today. In terms of the hospital situation, we now have 702 people in hospital, which is up from 670 for the preceding 24 hours. So that's a significant rise in the 24 hours leading up to 7 p.m. last night. Again, particularly centred on the Gold Coast and to slightly lesser extent, Brisbane south of the river. So we are expecting Gold Coast to peak sometime in the next week or so, and Brisbane will follow shortly thereafter. So looking at what happens at the Gold Coast, we'll be able to predict to some extent what is going to happen in Brisbane just a few days later. I've just got some interesting facts. I've previously mentioned that if you are unvaccinated, you are 9 times more likely to end up in hospital than someone who is triple vaxxed. So I previously mentioned this, if you are unvaccinated in Queensland, you are 9 times more likely to end up in hospital than someone who is triple vaxxed. Now, our statisticians have been busy at work looking at the intensive care units, and what they've found that if you are unvaccinated in Queensland, you are 24 times more likely to be admitted to a Queensland intensive care unit than someone who is triple vaxxed. So I'll say that extraordinary statistic again. If you are unvaccinated in Queensland, you are 24 times more likely to end up in an intensive care unit than someone who is triple vaccinated. I'm very pleased to see that almost 1 million Queenslanders have received their 3rd dose of vaccine. That's fantastic. I am still very concerned that there are vulnerable people, elderly people, who have not received their 3rd dose of vaccine, who might have received the 2nd dose of the initial course many months ago, is what we're finding. They're people that are often ending up in intensive care or dying. So they've received their 2nd dose many months ago, like the beginning of last year. And we know that the immunity wanes, particularly in the elderly and those who are immunosuppressed. So I'm particularly keen that the elderly and anyone who's immunosuppressed get that 3rd dose to prevent them ending up in hospital or intensive care. But of course, anybody for whom it has been more than 4 months since that 2nd dose of vaccine should go along and get their booster from their GP, from a pharmacy or one of the Queensland health sites. I'll now hand over to the Education Minister.
Thank you, Dr. Gerrard, and good morning everyone, in particular our Facebook followers. First of all, I want to say an absolutely huge thank you to our Queensland students, principals, teachers and school staff, parents and carers, in fact our entire school community, for their flexibility and resilience throughout these challenging times. We've had very positive responses to the announcement that the start of the 2022 school year in Queensland will move from January 24 to February 7, and obviously with remote learning for years 11 and 12 from Monday the 31st of January. This common sense measure is to avoid opening schools during the predicted peak of the Queensland Omicron variant and the wave, and allow more time for children to receive their COVID-19 vaccinations, and it's great to know that the best way to protect yourself is to get the jab, and the figures that the Health Minister gave this morning is truly wonderful, a brilliant uptake from our 5 to 11-year-olds during the first week that they've been able to get vaccinated, and a big thank you to the parents and carers that have brought those young students out, and it's been wonderful to catch up with some of them as well, and I believe that a lot of them have been very brave, and we want to thank them wholeheartedly. Those numbers are very encouraging. With the delay to the start of the school, it is important that student learning isn't impacted. That's why we flagged an extra week at the end of term, at the end of the year. I wish to advise that after some very constructive, helpful and productive meetings with the Queensland Teachers Union, unions and key stakeholders, I am satisfied that the full curriculum can now be delivered in the condensed semester. That's over the next 2 terms. This means that the proposed extra week at the end of the school year will not be required. Can I repeat? It will now not be required, and the year will finish as planned on December the 9th, 2022. Queensland has some of the best principals and teachers and staff in the country. They are highly skilled at delivering the curriculum across the school year, and students will not miss out. Can I assure parents and carers that they will not miss out on any essential content due to the delay now in the start of the term. They have done a magnificent job in rising to meet the needs of our students, and we are working on finalising a statement of agreement that the curriculum will be fully rolled out over the next semester, and I know that they will do a fantastic job in these uncertain times. I want to thank principals in particular. They have been absolutely wonderful in preparing schools for remote learning and the start of school. Teachers, teacher aides and all staff have done an incredible job, and they will continue to do so in what we know are very uncertain times. Can I remind parents and carers that while full remote learning will be in place for years 11 and 12, there are excellent resources for all students available on our website at our Learning at Home site. As I've said, our entire school communities, from students to principals and teachers and all staff, have shown incredible resilience throughout this pandemic. I want to thank them for that, and I am sure that they will continue to do so and ensure that students' learning will not be impacted by the delay to the start of school to the 7th of February this year. Can I also say that under the health advice that we are working nationally on a consistent set of guidelines on dealing with COVID in schools when schools do resume, and I look forward to working with Dr. Gerrard and of course through National Cabinet on national consistent guidelines. So thank you very much.
Minister, we obviously know that the Saudi trade settled this. People haven't seen their very show. What's the state doing to encourage people to get that triple vaccination?
Look, I would have thought these stats alone would encourage people to get a booster. Of the 29 deaths we've had since the 13th of December, we've gone back and looked at the data, and one person out of those 29 who have tested positive and lost their life had their booster. So we've just heard the statistics from the Chief Health Officer, the risk of hospitalisation going into ICU, but worse still, losing your life because of this virus. It is not worth the risk. The vaccine is available. I know that the Commonwealth are going through the aged care facilities, and I hope that we can get through all the aged care facilities as quickly as possible. They're not completed yet, and I know that the Commonwealth are stretched for resources as well in trying to get people into those residential aged care facilities to get them their booster shot, but we know they're the most vulnerable, so it's so important that they do get their boosters. But there's other people in the community who are also vulnerable, and please make sure you are getting your booster.
Are you running
Look, I am concerned that not all aged care facilities have their boosters yet, and I am concerned that people in the disability sector as well. I believe the Commonwealth are saying around 2/3 have already been completed. I'll also ask families who are working with their elderly relative to move them into nursing or aged care. It would be great if they ensure that they've got their booster before they're going into those facilities. And they are available. Boosters are available at our vaccination centres, at the GPs and at pharmacies. So they are available, but we just need to make sure that people are coming forward. And everyone needs to remember, if it's been 4 months since your second dose, no matter who you are, if you're 18 plus, and it's been 4 months since you had your second dose, you can come forward for your booster now. Look, I'm concerned because they're the most vulnerable. We know an outbreak in an aged care facility can certainly lead to far worse consequences. The Chief Health Officer has the breakdown of the data of how many people have been in hospitals versus aged care, but even in hospitals, often they may have been in aged care, moved into a hospital, those who have lost their lives. I am very concerned. They are the most vulnerable, and we need to prioritise them and make sure they're getting their boosters as quickly as possible. Where is it at? Look, I understand the supplies are starting to arrive now, but I also am aware that some pharmacies and GPs are not satisfied with the volume they're getting. So although their deliveries are arriving now, they're only being given 100 to 200 a week. And if those pharmacies, if there's GPs out there who say they can do more and want more, I hope the Commonwealth will step up and make sure that all of those have the vaccine supply they want. Yeah, it's disappointing. I know no business wants to turn away customers, but if you work in the hospitality sector, there's a whole lot of reasons why you can't go into a pub or a club. It's your attire. You can't walk in with thongs and a singlet on after a certain hour. All those sorts of things. We're used to having rules around going to businesses, but this is about safety. This is about those businesses looking after their own workers, and surely these businesses are concerned about having no staff if they all get positive. So I don't understand why they're putting their staff at risk and why they're putting their customers at risk by wanting to allow unvaccinated people into those businesses. It just does nothing to support the economy when you could end up all of your staff infected anyway. Sorry. Well, there's plenty of people, the good thing is it's the minority, but there's people out there in the community who don't believe in the vaccine or don't believe in the virus. Sadly, some of those people have got the virus and still don't believe in it, and so are not coming forward and seeking health treatment. But the evidence speaks for itself. Millions and millions of people who have been positive around the world, millions of deaths, positive cases, still in their hundreds of thousands overseas every single day, and all the data showing that vaccines work. I don't know how else to get through to these people, but what I do know is the mandatory vaccination rules we've put in place for certain venues and industries is paramount.
Minister, will you mandate the booster for the Queensland health workers?
We haven't at this stage. I don't think we need to. We've got a high rate of vaccination across our health workforce. Our health workforce are seeing the benefits of vaccination each and every day. Those working on the front line know that most of the people they're treating are either unvaccinated or not fully vaccinated. So our health workers understand the importance of getting vaccinated. Yep. Look, those discussions are going on with the Chief Health Officer currently. I know a number of communities have reached out asking for that. What's important here is whether it's a remote community or anywhere else, testing just tells us how many people have got the infection. It doesn't stop the infection. The vaccine is still the most important thing for those remote communities wanting us to switch to daily testing because they've got low vaccination rates. All that's going to do is tell us how many people are infected. It's not going to slow down the infection. What we need to do, what we need all of our mayors, all of those people in those communities focused on is getting that vaccination rate up. That's what's going to save lives in those communities.
We are working through a process in relation to making sure that teachers abide by the mandate to be vaccinated to come into schools, and I'm very pleased to say that those numbers are very, very high. We have more than ample relief teachers to cover them, and if by a certain date they don't meet that mandate, then they will be stood down without pay to show cause about why they should continue with the Department of Education. Yes, that's a great question about an outbreak in a school, and we're working on some nationally consistent guidelines, and I know that Dr. Gerrard through the AHPPC is working on how that can best be managed and contained. There's a lot of ways that we can do that, and we're looking forward to finalising those guidelines when school does return, and we'll follow those, and we're hoping that we can get a nationally consistent approach. And I believe this issue will be discussed at National Cabinet so that we are all doing the same thing when it comes to an outbreak in schools. But obviously safety comes first, and following the health advice is absolutely necessary to be done. Well, we're hoping not, but of course safety comes first, and we'll always follow the health advice. But if down south is any indication, which is why we've delayed the staff, there were, the start of the school, there were schools that were open 2 days later, they were closed, some then reopened again, then they were closed again. That uncertainty was very difficult for parents and carers in the beginning. We want to give as much certainty as we can, and we're hoping that the delay to the start of the year in a very uncertain area, we can give as much certainty as we can, but we will always follow the excellent health advice that we get. Yes, that's a great question, the ventilation and all of those issues. We set up a committee late last year of all stakeholders, including the non-government sector. We're working through any of those issues. We're following the guidelines in relation to that. As you know, schools in Queensland are a unique position in that nearly 96% of our classrooms, staff rooms and libraries are fully air conditioned. They are they are able to bring in fresh air, but we've set up a committee, we're looking at that, and we're following the health advice, but we don't want to put any students or teachers or staff or principals or any school communities in any danger, and we will follow the health advice to the T.
Minister, you've said that you've still got the 1 week, one extra week.
No, there's no extra weeks now at all. We are able now, through this agreement and through the excellent work we've done with the QTU and stakeholders and other unions, that we will be able to meet the full curriculum in the first semester. That's over the 2 terms. We flagged an extra week at the end of the school year. That now won't be necessary. We are more than satisfied of the excellent work that the teachers and principals have done to satisfy the department. I have my Director General who's been working very closely with all stakeholders on this, that this is now not required. We can meet that, and no student will be disadvantaged because of the later start to the school year. And that's exactly the outcome we wanted.
Minister, you said you put vaping in schools on the national agenda. Why can't Queensland take the lead and develop some kind of framework? Is this a serious issue?
We are taking the lead. We already do have a framework. We have Students' Code of Conduct. We have obviously all the education programs around the use of not only tobacco and vaping and alcohol. All of those issues are part of our curriculum. It's part of the Australian curriculum. We have an excellent delivery of education program to students. Vaping seems to be taking off at the moment, and it is concerning. And obviously, if there's a nationally consistent approach, a training program, but obviously we can't do it alone. Society needs to really come down heavy on these devices. I don't know what you call them. I've never actually even held one, to be honest with you, but on these devices that people seem to be getting their hands on, and we need to regulate that and ensure that we have a consistent approach to that. But yeah, I want to find out if other ministers have got great ideas. We can share them at the National Meeting of Ministers, and it's always great to have those conversations, and I'm looking forward to having that at our next meeting. But it is an issue, like cigarettes were when I was at school, but now we've got cigarettes, e-cigarettes, vapors, and obviously we don't just stop there. It's about all of those substances, and we want to make sure that our school communities are very well educated in obviously their use or misuse of them. Yes, look, that's a good question. Obviously, we delayed the return so we could get more children vaccinated, and I was very heartened with the Health Minister's numbers and percentages that we had today. So we've got those additional 2 weeks to continue to build that up. The health advice is that even one dose is excellent protection, additional protection for young people against the Omicron variant. We don't want to delay it anymore. We now are able to pick up the curriculum during the semester, so there's no disadvantage to education, and we're happy with where we are at the moment, but obviously these are uncertain times. We want to give as much certainty as we can, but we think at the moment, under the health advice, we're on the right path.
There have been quite a few deaths in aged care, as you would expect. We see a substantial number of the deaths during a typical influenza season are in aged care. That is the nature of the environment. This is a very different situation now in 2022 to say 2021 or 2020. So where we're seeing outbreaks in aged care facilities, often the cases are mild and the individuals are recovering. So the deaths are relatively uncommon. It's completely different to last year or the year before. So there is no plan or intention either at state or national level to close down aged care facilities to visitors in the near future. No. It's still early. It's heartening that the number of deaths is low. There's no question about that. But it's still early. The epidemic wave, the pandemic wave in Queensland hasn't even reached a peak yet, and we know it's a lagging indicator. So the numbers will increase. There will be more. So far the numbers have been small, but the numbers will increase. So yes. So far it's heartening, but it's still early. The numbers will increase. I have data. 5 were in hospital, 2 were in aged care. That's appalling. That's utterly appalling. The vaccine, I think, at last count, it was at least a million children. I can't remember the number in the US had already received this vaccine. Very large numbers of children in the US have received the vaccine. And there's no safety data signal at all on its use in children. So that's just appalling. It's appalling that people would lie like that. It's hard to know at this stage. We're putting together a framework and a way of dealing with. There will be outbreaks of the virus in the school. We know that. It's going to happen. When the schools open, there will be significant numbers of cases. And the good news is, and I really must emphasise this, the vast majority of children, when they get COVID-19, get a very mild illness, like a typical respiratory infection that any child gets. So that's not, that in the vast majority of cases, not a great concern. But we will be seeing outbreaks, and we will be trying to control them as best we can. I don't have that number. There are quite a few still, and they will be reducing. It's quite complex. There's some that are on, they're all on a lease. Some that are coming up at various points to the end of their lease. So at the moment, at the moment we have a few different groups of patients in these hospitals. There are some people who are positive. Say on the Gold Coast, for example, you will have people who have tested positive in a holiday makers in a hotel, but they're not sick. So they have to go somewhere. In the old days, we used to put them in hospital. Now sometimes they may go to an isolation hospital. Then there are hospitals use this for isolation purposes. Hotels used for isolation purposes. And then there are the quarantine. That is where there are close contacts of positive people who cannot, who are at high risk, who should not be accommodated, should not stay with someone who is positive. And then at the moment we've still got the overseas quarantine group, and that's likely to end soon, as we all know, and the interstate quarantine group, that's ended. But, what percentage? I'm afraid I don't know that information. No.